Okay, I'm about to show you a video of an analysis of 3 x-rays that I had done whilst I was an inpatient at the Royal London Hospital. I was taken in on the 8th of November and I left on the 19th of November. So the first 2 I'm going to show you is the shoulder and the chest. Both have been doctored, and I'm going to prove that to you in a minute. Also, as a comparison of these 3 x-rays, I've got another x-ray that I had done in 9th of December 2008. This x-ray in particular is the best one I've got. It's perfect, okay? It's not been doctored, so I'm going to use that. It's the blue one. It's a blue one, so you'll be able to spot it whenever I use it. But I'm going to use all 3 x-rays with the comparison of the older x-ray that's not been doctored, so you can see what it should be like and what it is like, okay? And this is what you're about to see is absolute, solid, undeniable proof that these 3 x-rays have been digitally altered. So we'll see a bit of my broken rib as well, because they've tried to cover that up as well, and that's the biggest part of this. They've tried to hide my broken rib and the drop in my shoulder. They've tried to build it up using Photoshop, okay? The radiographers who are responsible for these x-rays is Dr. Sanjay Karamsadkar and Sivadis Ganeshalingam. Here are the 3 x-rays that we're going to be analysing in this video. We're going to number these 1, 2 and 3 in that order. X-rays 1 and 2 were both done on the 12th of November, 1 minute apart from each other. So if you look at the times on there, they are literally 1 minute apart from each other. Okay, so let's crack on. This is x-ray 1. We'll call the blue one x-ray A. So we've got x-ray 1, 2 and 3 plus x-ray A, which is the example of what it should look like. So without further ado, let's get on with this. First thing I want to point out is look at my right shoulder. That's the one on your left. Okay, it's been cropped right at the edge of the shoulder blade, because you can clearly see my left arm, the shoulder, but where's my right shoulder? They've cropped it off deliberately to hide the damage caused, which you're going to see in a minute. So we're going to start on the right shoulder. Let's zoom in on that and have a look what they've done to try and disguise the damage caused by xrays in 2001. So you can clearly see now that my clavicle is just half the length of what it should be. You can see my shoulder's completely collapsed. Also, the AC joint has also been amputated. For those who don't know what the AC joint is, this is it here on the other side. This is what they've taken off. It's what the clavicle butts up against. Should do. Right, so let me give you an example of exactly what he did take off of me. The xrays. So we'll highlight around the clavicle and the AC joint. Okay. We'll shave off what Reese's took from me in 2001, and all done without leaving a scar. Now watch what the results are of what he did. That's my bad shoulder flipped over, and that's the amount it's collapsed. Next thing I want you to look at is the thickness of the skin above my clavicle. See how thick it is? That's not normal. That's normal. Not that. That. Okay? Clearly see what it should look like there. And that's what they've given us. Clearly, we've doctored. Now watch what happens when I increase the contrast. Oh, keep going. Look at that. Photoshopped. Blatantly photoshopped. You can clearly see that they were going to paint it on, but then they decided against it and they masked it with that black shadow, that black shape over the dark bit. Which is why there's two lines there. Also need to point out that this particular X-ray was taken while I was lying down because I was unable to stand at that time. So now we're just going to be focusing on the bottom half of this X-ray. So I'm going to bring in the old one, X-ray A. So I've got X-ray 1 and X-ray A. And I'm going to do a bit of comparison to show you what's going on. So we're going to be taking a closer look now at the right and the left hemidiaphragm. Also notice that this X-ray is slightly tilted towards the left as you look at it. So I want you to take particular notice here and here at the bottom of the rib cages. Notice these two are at different levels. Now let's bring in X-ray A. Notice either side of the rib cage is absolutely symmetrical, both the same on either side, yeah? Now watch what happens when I add X-ray 1. What's the difference? Now I think you'll agree that's a big chunk. So would that difference be because of slight angle of X-ray 1? So let's have a look at the difference between the aortic arch, which is here. So let's see just how much this moves across compared to the levels below earlier. So let's introduce number 1. There you go. That's a fraction compared to the lower measurements. Which brings me to the conclusion that this has definitely been doctored. They've been adjusting that hemidiaphragm on both sides in a failed attempt to hide my broken rib. Now let's look at it from a different perspective by inverting the image. Oh, that's number 1 inverted. Now let's overlay X-ray A, which gives us a clearer picture of exactly where they've altered it. The dark edges, even up the side of the spine, have been altered, which is why the spine looks thicker on X-ray 1 compared to X-ray A. So now let's invert X-ray A. Like so. And then X-ray 1 inverted. Now let's compare the two together, which gives us an even clearer image of how much they've added in a desperate attempt to hide my broken rib. So that concludes X-ray 1, and I think we can safely say we're looking at a criminal offence here, namely fraud. If you think this is bad, I can stick around because they get a lot worse. So let's move on to X-ray 2, shoulder X-ray, both taken at the same time, remember. And this is why they didn't want us to see these X-rays, because they spent 24 hours doctoring them. So the first thing to notice here is, again, double skin. See how thick it is. So let's see what it should look like before it was doctored. skin above the clavicle is so thin it doesn't show up on an X-ray. That's how thin it is. So how come we can see all the skin? Okay, anyway, so now let's take a look at the lower part. Here. Notice how the white borderline around the ribs is really thick at the bottom there. Quite thick all the way up. That's because it's been painted, which will become more evident when I overlay the X-ray A. And also notice there's no sign of a broken rib now, is there? I wonder why. Probably because they've camouflaged it, completely hidden it. So there's a join mark there in a rib, and covering the broken rib with that black section there. That whole area is completely fake. So let's try overlaying X-ray A over the chest. There's my broken rib. Watch how this thin white line gets thicker on the next X-ray. See that? It's thicker now. Now watch it go thinner again. There you go. Look at that. This is proof that they're painting over my ribs to try and disguise that broken rib. See, the hemidiaphragm goes up and the ribs come in, like they're shrinking it, by painting over the outside line and over the bottom two ribs. Now I want to divert your attention to the armpit. Take a look at that. Got 3 armpits. And also take a look at all these the grey blotches everywhere. That's from the spray can on the paint shop. This is why it's taken me 20 odd years to find someone to fix my shoulder, because they've all been lying. I'm pretty sure my records have got a DND on it, do not diagnose. Okay, let's go a bit deeper now, and let's invert this, see what we find. Just zoom in a bit. Okay, there we go. And voila! Here we can even see the brush marks that they've used to cover up the original line. Okay, so let's just add where the skin should be. Seriously, how are they going to explain that? I don't want extra skin on my shoulder. I've gone over their original work just to highlight it a bit more. There you go. So that's exactly pretty much what they've done. They've added that. I have to say though, they've done a pretty shoddy job. Look at those brush marks there and there. Look, that's where the skin should be. I don't want anything above that. It's all fake. Let's just uninvert that one back to normal. There we go. One more thing. Look here on the ball joint. You can see where it's all worn down. See, that's where my subscalpel has been digging into it. And my doctor's just told me after having it scanned that there's fluid leaking out of the ball joint of my arm. So that just about concludes the shoulder X-ray. So I think we can safely say that that's also been doctored. Even without the enhancements, you can still see that's been doctored. So these last 2 X-rays that you've just witnessed, we made it clear that we weren't happy about them. And I'm about to show you exactly how that went down from footage from the hospital. But the day of the X-ray, on the 13th, I think on the 12th, the following day on the 13th, a woman doctor came up to see me to ask me some various questions. This one in particular. Check this out. Alright. So if you take one look at that, seriously, there's no AC joint, there's no ligaments. Yeah?
Have you seen the pain doctor?
Let me show you. I have. Let me stand. I want to show you my shoulder. The drop.
Coming up to today to see me, but
You know what number they're on? You can phone number for them.
no. I wrote it down. I left it indoors.
Oh.
But
You've got your own clothes, by the way. You've got your own clothes.
yeah, you're in there. But
Okay, let me take this out. Let me take that one out. Just slowly.
What do you see?
So you've got a scar there. So I'm talking
No,
about the
no,
back.
I'm asking you. What can you see now?
Just when I
So it's uneven.
when
I
I
think
How much?
I don't bring me a meal up
Quite a lot.
How much?
I don't bring me a meal up
Quite a lot.
Quite a lot.
I don't bring me a meal up
Quite a lot.
Quite a
I
lot.
don't bring me a meal up
Quite a lot.
See now.
just when I
So it's uneven.
See now.
just when I
So it's uneven.
when
I
I
think
How much?
I don't bring me a meal up
Quite a lot.
How much?
I don't bring me a meal up
Quite a lot.
Quite a lot. That was at 10 a.m. in the morning on the 14th. At 7 o'clock that night, the doctor finally came along with my x-rays, well, these two. And this is exactly how it went. What's suggested?
So there's no fracture, there's no dislocation. The joint spaces are correct.
What, you say that's normal then?
The only issue is that as you mentioned earlier, your AC joint, yeah?
Gone.
Well, that's because you had the operation on that shoulder.
I had a ruptured clavicle.
Yes.
I didn't know I was going to have an amputation of all my ligaments, my AC joint, and half of my clavicle's missing. Look, you can see it.
That's part of the clavicle.
I know exactly what I'm looking at. I know I can read X-rays, and that is a completely collapsed shoulder. My arm is not connected to my skeleton, is it? Where is it? Can you show me?
That's your arm there,
I know that, yeah.
and that's your
Yeah, that's where
shoulder.
the AC joint should be, which it's not anymore. I've been seeing lots of surgeons about this, so you can't tell me there's nothing wrong with my shoulder,
Well, the
because that was
actual...
what it sounds like you're saying.
I'm not saying that. I said that the AC joint, clearly you've had a procedure on the AC joint. So
Yeah, not the procedure that I was got in for though. That wasn't what I went in for.
I can't comment on that. So I
No,
don't
I'm
know-
telling you.
Yeah.
I went in for a routine clavicle repair. So, and I ended up without a shoulder.
I can't comment any further because I don't know. Okay.
Right, I know that my shoulder's got no suspension mechanism. I've got a report that confirms that by 3 separate surgeons.
Okay.
So if you're going to start saying there's no abnormality, then we're going to have a serious problem.
I didn't say there's no abnormality.
Well, you kind of hinted at it, I think, didn't you?
I didn't.
I've got better X-rays than that here, which show that I've got no clavicle, I've got no ligaments, and I've got no AC joint.
Well, you do have
So
a clavicle. It's there.
Yeah, yeah, half of it. It's been amputated, look.
I mean, I can't. I'm not making any comments about what this X-ray shows. You asked me
Well,
to-
you just basically told me that there's no abnormality, basically, haven't
I
you?
didn't say that at all.
Right, can you give me what the diagnosis is then of that shoulder?
I can't.
Why not?
I can't interpret that myself. But according to the radiologist, it looks like there's no fracture, there's no dislocation, but what it is that there appear to be some changes at the AC joint, which will probably be in accordance with the surgery that you've had in the past.
Let me tell you what's happened, right? I've had all my ligaments removed, right? You can see that, agreed? Half of my clavicle has been amputated. There is no AC joint there, unless you can show it to me. Can you show me the AC joint, perhaps? You can't, can you?
I'm not a radiologist.
No, you can read X-rays. You're trained in X-rays, right?
No, I'm not.
What?
You asked us, you requested that we show you the scan. That's exactly what I'm doing. I can't comment on what the scan shows because I don't know myself.
Well, I
Can
can
give
see
you-
it.
Okay, so
But I requested a chest X-ray. Where's that?
I can show you that as well. I'm not saying anything that is different to what anyone else has said. I'm just showing you the images that you requested.
All right.
Okay? And
So can I have a look at the chest one now, then, please?
Okay. That's chest X-ray.
Right. So why have I only got half of my arm showing there and not there? That's been cropped. It happens every time. You always crop it where my amputation is ended, right? because this is why I wanted to see these. I wanted to see if you was going to doctor them or not, and I can see they have been doctored, because that's been cropped down that side. Correct or not?
They've not been doctored.
Now, I'm seeing an X-ray there that's been cropped at the side. I've got other ones very similar to that. They always get me full arm on that side, and they get it at the end of what's left of my clavicle on this side. That's been altered. I wanted to see the both angles so I could see the comparison. Look at that collarbone up that side, the other side, right? That's right at the top of the screen, yeah? See that? See my clavicle on there, on the right-hand side of that side? Can you see that? See how high it is? It's just under the top of the picture, isn't it? Not the top of the clavicle, right? So when you look on this side, look, there's about 3 inches difference. Can't you see that?
I can't comment on the...
But can you see that? I'm asking you if you can see that or not.
I can't comment.
Why won't you comment then? I'm asking you for your diagnosis of my X-rays, and you're saying you can't comment.
I can't, because the chest X-ray shows that your chest is clear.
Does it so show your malunited rib? 9th and 8th rib trapping the nerve?
Well, that's not what's been reported.
No, so this is no good to me. I want to see the complete X-ray, please.
Complete X-ray.
No, it's been cropped. It's been cropped. I'm telling you. I'd lay money on it.
Okay. Well, I've done.
I don't understand. Well, I've asked you for a chest X-ray, right? A symmetrical X-ray, right?
Well, I can only work with.
All I've got is a part of an X-ray because, as before, they always chop off my arm. My right arm is always cut off.
Like the X-ray has not been doctored.
I'm telling you, that's been cropped. You just told me you can't comment, but now you're saying it's not been doctored. How come? Why is only one arm visible?
It's just
they're supposed to be symmetrical.
Because it's a chest X-ray, so we look at
they're
the
supposed to be symmetrical. I know what a chest X-ray is supposed to look like, and every one of mine has only got one arm on it because they always crop it down that side. I'm not getting what I'm asking for here. I'm asking for a proper X-ray that where I can see both shoulders. Otherwise, how are you supposed to compare it?
Because if you look at...
But if you're in denial, hang on a minute, see that big gap at the top of there, on the left? There's no gap over there, is there? Hang on.
Let me speak for a minute.
Well, no, hang on a minute. I'm just trying to explain something because I'm trying to get an answer from you.
I can't.
Right, well, I'm just... Listen, please, can I just finish what I'm saying?
If you want to look at the shoulder, we get a shoulder X-ray, which we have done. If you want to look at the chest, we get a chest X-ray. So in this case...
Right, okay, but I want to know...
The chest...
Yeah, okay, so... See that, right, see the good shoulder? Right, look at it. It's right at the top of the picture, yeah? Right where my AC joint is.
The study is not looking at the
shoulder. No, listen, you're not telling the truth here. That's an AC joint on there, right? Where's the AC joint on this arm? Why is it not there? Because it's been amputated.
The point of the study is not to look at the shoulders. The point of the study is to look at the chest. So that's why it's called a chest X-ray.
Which is a blatant lie, because look what it says there. Reasons: widespread body and back pain. Doesn't say anything about looking at my chest.
Looking at the shoulder, we need to get a shoulder X-ray, which we've also got. Looking at the shoulder, we need to get a shoulder X-ray, which we've also got. Does
that shoulder look the same as the one on that side then to you?
Do
they both look the same?
Yeah, it's hard to tell because you
Why?
can't see both shoulders in the picture.
Because what?
Because you can't see both shoulders in the picture.
Oh, exactly, why not? They're the same.
Yeah, it's hard to tell because you
Why?
can't see both shoulders in the picture.
Because what?
Because you can't see both shoulders in the picture.
Oh, exactly, why not? Exactly what I've been saying all along. Why couldn't you just say that at the beginning? I want to see both my shoulders in that photo.
The study is not to look at the shoulders necessarily, it's to look at the chest. What we have done. The study is not to look at the shoulders necessarily, it's to look at the chest.
Well, like I said a minute ago, these X-rays was for my whole of body, widespread body and back pain. What doesn't he understand about that? Okay, well, can you just explain one thing? Look, on there, right? Looking at that X-ray.
Yep.
Why is that left clavicle up at the top of the picture? And if you look at this side, can you look at it, not me?
I've already seen it.
Yeah, well, can you look at it again? Because I'm pointing it out to you. Right, that big gap there, how do you explain that?
The position in which the X-ray is taken. The position in which the X-ray is taken. The position in which the X-ray is taken.
No, that's a front-on X-ray, right?
Okay.
Yeah, and I'm sorry, but there's nothing you can tell me now to make me think that I can trust you anymore. because of this. Because everyone does it. That's why you wouldn't show me it yesterday. You needed time to doctor it. That's why you wouldn't let me see it yesterday.
To answer this phone call, okay. I did my duty. I showed you the imaging. It's for you to make your own deductions. But I've got nothing more to add.
Right. So basically, you're not giving me any information on my X-ray.
Phone call. Sorry, I was upset about the phone call. My apologies for that. As you saw, those images we have, I can't really add anything more.
I know, but I'm finding it hard to accept that you saying that there's no abnormality in my shoulder when there clearly is.
I didn't say that.
Yeah, you did.
I can't comment on any abnormality because I'm not trained.
What?
I didn't say that.
Yeah, you did.
I can't comment on any abnormality because I'm not trained.
Well, who does it? I've not had anyone give me a diagnosis of my X-rays yet. Then why is that?
The radiologists are responsible for.
Yeah, I know who's responsible for them.
And as I say,
But I need the name of that radiologist as well,
they've
please.
suggested that They never said there's no abnormality.
No,
They never said there's no abnormality.
No,
They never said there's no abnormality.
No, I don't understand why they never spotted that broken rib. It's blatantly obvious, but no word of it. I want the name of the radiologist, because there's going to be a claim put in.
Yeah,
All right? There's a lot of jobs going to be at stake. All right, Luke. Just show. Can you show him now, please? My X-rays. Dr. Luke, cropped.
Chest X-ray.
That's not
Look at the state of that.
is it? Look at the state of it.
Look, well, you've got one arm on there, not the other.
We've got that arm there, and this side, it's all got like...
Gets cropped.
It's cut off. That's not right. I know you can do a better job than that. Look at the difference, Doctor, between that and that. Look at this. Look how short that is compared to that.
Completely
That's
collapsed.
joined up there to that. This isn't. This hasn't even got this bit here. So why is that? Why can't we see both of that? I'm not accepting that.
Because they don't want us to see it,
The
Luke.
chest X-ray is to see the chest, and that is what you can see fully.
Right. Yeah. But the shoulder X-ray hasn't. I'm not having that because you need to have both shoulders done so that we can see the difference between that one and that one.
Yeah,
something needs to be done about this. This is why we have to record anything, because a lot of you guys are contradicting each other. One says, what people are telling me.
Anyone is contradicting.
Oh yes, they are. Well, I'm being
shot.
I'm being suffered now. Loss of suspensory mechanism, which no one's explained why it was all removed, and that's what we're going to be finding out next.
Why is his shoulder so low to the other side like that?
Yeah, what's your reason for that?
So you obviously had some surgery on your shoulder,
after
and
surgery,
that explains the changes that we have seen.
Well, I've had three different surgeons, right? One was in Poland and two over here, all agreeing that I'm in need of at least 3 major operations to fix my shoulder, but they're not even possible if they could do it, because one surgeon said to me, when I first found out about this, because originally I thought I had a dislocated shoulder blade, right? Okay. So when I was rushed to hospital in a couple of 2010, he said to me, I can't. I said, are you going to fix my shoulder? He said, I can't. I said, why not? He said, because there's nothing to operate on. And I went, what do you mean? I didn't know what he was talking about. He said, because I said, why? And he said, because it's all been excised.
These are all the X-rays that we have. As you can see, these are the X-rays that we have. Okay, this is the shoulder, and I showed you the chest. This is what we have.
Yeah, but let's show me the chest again, because I was sure they took 4 X-rays.
This is the chest.
Right, now let's have a good look at that. Stare at that. Look at the difference. See that big gap there? There's a gap like that, right?
Okay, so that's what I had to show you. Alright, I've given you all the information.
But wasn't there more than that? I had more than 2 X-rays done.
So you had various angles of your shoulder.
Yeah, where's all the other ones then?
It's all here.
There's 3 there.
That's your shoulder.
I can't see that for me. The light's all over it. Oh dear, look at the size of that gap. Let's have a look at that. Hang on. Well, that don't look great, does it?
No, none of it does really, and I can't believe you're standing there and saying that that's just not ordinary.
Well, that's what they all say. They're told to lie.
I don't think anyone would lie to you. All the
Yeah,
information-
hang on a minute. Well, how do you know that no one would lie to me?
all the information.
We have proved that we have been lied to.
We've got the proof. Yeah, it's not,
Thank you
we're
very
not
much.
just guessing this.
Yeah.
We know for a fact.
Well, I've shown you all the images that I needed to show you. Because
Well,
of
he's
that,
had a lot of
things are-
Because I'm
surgeries, doctor,
blacklisted.
and
Sure.
people that have a lot of surgeries are like they need follow-up care, and he has had none, and he needs some at this time and moment now, and this is what's going to happen. He needs.
I'm like a car crash victim that's been left in the road. That's what I'm the equivalent of. My neck, knee, back, shoulder, it's all gone.
But I've had a chat with
Both
the
my
neurosurgeons
hands.
as well today, and they suggested they will see you hopefully today or tomorrow. As I say, you can have a further chat with my consultant if you feel that there's anything else that you're missing. But that's all the original stuff we have there for you. Okay? With all due respect, I need to get off and.
Yeah, all right, fair enough.
Thank you.
No offence.
Please do the right thing, no doctor.
We're desperate here.
This man
The
needs
thing is
care,
this, right? The
that's
thing is
bottom
this,
line.
right? After 19 years of going through this, I'm about ready to top myself. Okay. Now
As
it's
the
down to you lot here
But we're trying
to
whatever
stop
we
me
can.
from doing that.
We're trying whatever we can to.
You know, you're not though. You just doctor my X-rays. That's not helping. Oh God. Reason for referral: cause of acute shoulder pain. He lied and said that these X-rays were not about my shoulders. He said they were to look at my chest, which was a lie. The next day, the 14th of November, I got a visit from Dr. Tom Oates. Just have a listen to. It was quite a long conversation, so I've just picked out one part of it. That was very interesting.
Yeah.
So if you would be kind enough to send me down for another one, I will get out of bed and stand in any position they want me to get a proper symmetrical X-ray of my chest. Because I don't know if you noticed the break in my rib, did you? Like you can see on that one. Oh, hang on. Let me show you that. I've got a really bad fracture in my rib. I'll get the blue one up. Hang on a minute. Look, these are all messed about. There's little grot marks all over them. Look. Oh, that's not your firm. That's not your business. Yeah, look. There's a close-up of my shattered rib. So, do you agree that's a broken rib?
So yeah.
Do you agree that's a broken rib?
So yeah.
So on the 17th of November 2018, we got the doctor to give me another X-ray, and I said, and this time I want to see both my shoulders complete, because we weren't happy with the quality of those earlier X-rays. So what they did was take me down for another chest X-ray, with the promise that I'll have both my shoulders included. And look at what we got. Straight away, look at the thickness of the skin. It's even thicker than X-ray 1 and 2. But at least they kept their word on these two shoulders, but they didn't say they was going to make me look like Arnold Schwarzenegger. And look how high the hemidiaphragm is. We'll be looking into all this in a minute. And did they really think that I wouldn't notice this? They painted a face over it because the rise in the shoulder wouldn't match up with my neck. So to hide the joint marks, they've painted a face on it. What on earth are they doing? Okay, so the next day, on the 14th of November, the neurosurgeon, Dr. Sarouche, came to see me. And have a listen to what, this is just a few excerpts out of a long conversation. Don't have to video, you know, unnecessarily. Just
Okay, all right.
the audio, dude.
So, how long have you had problems with your shoulder for?
Well, originally, I had a ruptured clavicle. All right. Have you
Ruptured clavicle. I've looked at your X-rays. It looks like someone's chopped the end of your clavicle out. Is that right?
You could say that.
Clavicle. I've looked at your X-rays. It looks like someone's chopped the end of your clavicle out. Is that right?
You could say that.
We can get into the shoulder clinic here. What to me sounds like the symptoms you're getting in your hands are possibly coming from your neck.
Oh, no, yeah.
Trapped those in your neck, yeah. And
Yeah,
I think
just want to show you.
exactly,
One way,
exactly, yeah. All right, yeah.
Give us a couple of minutes. A couple of seconds. Hang on, I'll dig it out.
So look, I can ask for that to be arranged, and then we can see in the clinic and see if we can try and reconstruct your shoulder girdle again. See if we can try and reconstruct your shoulder girdle again. At least we can get you starting with some physiotherapy to build up the muscle to get that back where it should be.
Roger Owen, Professor Roger Owen, his report stated that his findings was total loss of suspension mechanism.
Yeah, I agree. I think I agree with
You
that.
agree with that? Yeah?
Yeah,
That means total loss of suspension mechanism.
yeah, I agree. I think I agree with
You
that.
agree with that? Yeah?
Yeah, I agree. I think I agree with
You
that.
agree with that? Yeah?
Yeah.
That means it's all been amputated. No one told me why. It's just been covered up, you know? Yeah. First of all, I'll show you my knees.
Yeah, okay.
The state of that one, right?
Yeah, the left one's quite bad, yeah, yeah.
The state of that one, right?
Yeah, the left one's quite bad, yeah, yeah. Okay, yeah.
Just took all the cartilage out.
Yeah, 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 I can see that, alright.
Just took all the cartilage out.
Yeah, 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 I can see that, alright.
I've been walking on that for 19 years like that. And yet after all that, I never saw him again. At least he was honest. So remember, I had the X-ray number 3 done on the 17th of November. Right? What you're about to see was filmed on the 18th of November of the Dr. Cheeroff, avoiding showing me it. Right? I didn't actually get to see it until the 19th, which you'll see at the end. Dr. Cheeroff was more interested in the fact that I was recording him than any of my problems. He was going to come and show me the X-ray, but I said, can you wait till my son gets here? He was on his way up. So while we was waiting for my son, he came back with this.
Yeah. This thing about recording,
Yeah.
it's not something we approve of.
It's audio, it's only audio.
Yeah, but it's not something I really want.
Yeah, I want to though.
Yeah, but I have a say about it.
Yeah, but no, really. If we're going to go, we've already been through all this, right? I've just woken up. So if you want to, start arguing about all that, we'll have to wait till my son gets here.
Okay, shall I come back and see you when your son's here?
Yes.
Right, okay. But I have to warn you that when your son's here...
We've looked into the legal aspects of it, right? And we are allowed, legally, to record anyone we wish. Anyone, yeah, any...
Sure, yeah. But I'm also allowed not to be recorded.
No, you're in the professional capacity.
Yeah, but I'm allowed not to be recorded.
Not if I need it.
That's not true. What I'm saying is...
Protection.
The law doesn't tell me I have to be recorded.
I'm telling you that I have to record it for my own personal safety and yours.
Okay. Just to forewarn you, when your son comes, if he's going to record, then I won't be having the conversation with him. Okay?
Well, we was going to have a three-way conversation with our legal department. About half an hour later, still my son hadn't arrived. He came back and check out what he did. Bear in mind, he was supposed to be coming to show me the X-ray that I had done over 24 hours ago. I'm not filming you. But I'm not supposed to be talking to you until my son gets here, either. Hello, I can't stay until your son comes. I've finished work. I'm leaving. That it? What about the X-rays I wanted to see? You're supposed to be showing me my X-rays, are you not? Hello? All that took place on the 18th of November. Happened to be my birthday. Later that night, my laptop was stolen. And I believe the nurses who were on shift that night were responsible. So on the 19th of November, we decided my son wanted to get me out of there now. He knew I wasn't safe to stay in there. So he had me taken out. But we refused to go anywhere until I've seen this X-ray, which was taken now 2 days ago. Right? Cheeroff told us that he's not going to speak to us anymore until he's spoken to his legal team.
I understand that you want to record.
I don't want to, I have to.
Yeah. I'm not agreeing with that. So
no, you don't have to either though.
I'm waiting on legal advice.
Yeah, well, you can wait on it what you like, but we don't follow your policy. You see, yeah, that's your policy, that's your rules for your building. We're not staff here. Yeah? So you choose to document your stuff in writing. I choose to document my stuff by videoing it, and that's how it's. That's
More accurate. No mistakes.
Before we finish, what we've spoken to the nurse. I don't know if you're aware now. We're going to get him discharged today. But before we go, all I want to ask for you, I don't want nothing else of you, because it's clear you're not going to help this man or diagnose him or give him any duty of care at all. So we request that you give him the X-ray that he took the other night, a copy of his medical notes since he's been here, and then we'll be out of your hair and we'll deal with you at a later point in time.
Okay, we'll see what we can do. We're just about to meet with the nursing staff. Okay, so I think a copy of the X-ray should be no problem.
Do I get to see this X-ray that you took the other day, Luke? I haven't seen it yet.
So you can get it on a CD-ROM text.
Yeah, they've already given us one for free that we had, but 2 nights ago we had another one which hasn't been...
The chest X-ray you took the other night. I want to see it.
Okay, alright.
Where are you going with that then? Don't we need that for the X-ray?
No.
Excuse me?
He's going to get it on the CD-ROM.
Well, don't we get to see it first? Don't we get to... I'd like to see the X-ray first. I've not seen it.
I have to get it on a CD-ROM for you.
No, you can bring it on the screen now and show it to me.
Do that.
We did it the other day. We did it the other day. We did it the other day.
Have done it already.
They've already done it once.
So it's not policy.
So you can do it. So don't lie to us.
Contradictions all over the place.
So they're lying about that now. They don't want us to see it, Luke. They really don't want us to see this X-ray, do they? I wonder why.
Hello, good afternoon.
Right, what's the same? Look, what's this? Look. Right, so...
So they haven't done what we've asked again.
No, not properly, have they? What's all that stuff on the top of my bone there? That's thick stuff. What's all those lines doing down the side of it?
That's just the screen's a bit damaged.
The screen's a bit damaged?
Yeah.
What, all these lines down there?
These lines that go through the screen, yeah.
Right, so what's all that above my what's that? I can't sit up, Luke. Can you point it for me?
You can see that this...
No, the flesh, the added skin.
This.
Right, what is that? Are you going to tell me that's
your shoulder.
Well, you're telling me that's my muscle, is it?
Yeah.
Well, you're telling me that's my muscle, is it?
Yeah.
When I haven't got any muscle there at all. My skin is millimetres thick.
Yeah.
You've done exactly the same as what someone else has done. I know exactly what you've done here. You've doctored that.
That's why
I am now accusing whoever done this. Who's responsible for this?
Radio.
What's the name?
The radiographer. There isn't a name on it.
There better be.
As I said to you.
I want a name of the man responsible, because I know a doctored X-ray when I see one, right? And that is a doctored X-ray. And if you're trying to tell me that's my skin, that more like Arnold Schwarzenegger's shoulder may look like that, but mine don't.
So
that's been added.
That's been layered because
it's been done
to
before.
Make it look the same as that.
I'm not an X-ray specialist.
Yeah.
I'm not an X-ray specialist.
Yeah.
I'm not an X-ray specialist.
Yeah. Well, why don't you send someone that is?
This is your
X-ray. Come and view them with us.
This is your X-ray. I've shown it.
You're non-specialist.
We're done.
Who's
Okay.
a specialist? Yeah, you are.
What do you mean we're done? You are definitely going to get done.
You're a judge, mate.
Right, on the final leg home now. 11 days of my life wasted. I'm in the back of the ambulance now. Luke's in the back over there. Look, there he is. On my way home finally. What time is it, Luke? About 8, half 8, isn't it?
Half 8, yeah.
It's about 8:30 on Monday night, Monday the 19th. On my way home.
Oh, God.
Right. Oh, where we go? Here we are. Just pulled up outside my house in the ambulance. I'm just going to get me outside. Finally, home to safety. 11 days of sheer fucking terror and torment. Oh God, I've had a terrible time, mate. And oh boy, was I glad to be home. Especially that I can have a proper look at that X-ray now. You're about to see what I found. It's absolutely shocking. Okay, so let's take the neck from X-ray 1 and overlay it onto X-ray 3. There you go. That's what that should look like. Minus Arnold Schwarzenegger shoulders, and I've barely scratched the surface on this one. So let's just lose the text around the edges. So let's begin by adjusting this to what it should look like. There we go. Exactly as before. They've raised the profile in order to disguise my collapsed shoulder. Look at that. It's just beyond belief that they thought they could get away with this. So let's zoom in and have a closer look, shall we? Not even bodybuilders have skin as thick as that above their clavicles. See that? There's the clavicle there. No muscle above it whatsoever. Look. So it don't matter who you are. You don't have muscle there. Nothing like this monstrosity. Now watch what happens when I increase the contrast and the gamma. Boom. Look at that. Brush marks. Photoshopped. No doubt. I've not added any effects, I've just increased the contrast and the gamma, that's all. Look at it. This is the original X-ray. Maybe not the original, because the original wouldn't have been doctored, would it? Look at that. Diabolical. Anyone can see that that's been doctored. Look. It's unbelievable. Look at those brush marks. All to raise the profile of my shoulder in order to defraud me and anyone else who looks at these X-rays. Okay, now let's overlay this over a picture of me. See how thick that skin is? Then that's what it should be like. It doesn't line up with my body when it's up there, does it? I'll share that. Okay, so I'm going to leave that undoctored the way I did it. I'm going to crop the right side shoulder as you look at it, flip it over like so, and then put that over my bad shoulder. There you go, that's what it would have looked like. Thanks to Nicholas Reese's, it looks like this. Which is something nobody should have to suffer. It's criminal. Okay, now let's have a look at this fake head. This ridiculous painting over my neck. This is what it should look like. There. Look, that's what you should expect to see. Not that. What is that? What does it represent? My head? Which is not really possible because my head wasn't even in the shot. Okay, now it's time to bring in X-ray A, again, the blue one. We'll line it up with that. So let's put a line over the hemidiaphragms and watch just what they've taken out. There you go, look at that. This is proof that they're hiding my broken rib because it's been misdiagnosed for 10 years now. It won't heal. Went to Poland in 2012 and they diagnosed a malunited 9th rib, trapping the nerves between the 8th and 9th rib. Look, you can still see the original line. At the end of the red line, you can just look there. See? There. It's the same line from the blue one over to the white one, see? You can blatantly see that they've coloured all this in, completely hiding the broken rib. Look, it's gone. That's what we should see. Okay, now let's have a look at the armpits, both of these X-rays. See that? That's the good one. It's double there. And you can see these dark lines have been drawn in. You can blatantly see that is marker pen from the paint shop. No doubt about that at all. Okay, Now let's zoom in a bit on it, and we're going to invert it. Let's see what we get there. Okay, that's the 3 inverted. Now let's put in X-ray A, blue one, and invert that. Okay, so now let's overlay X-ray 3, and there we go. Look, that gives you an accurate view of exactly what they've overlaid. Just look at that. So I've taken this image and I've outlined it over in black, exactly where they've looked at it. All those areas in black is what they've done. They've done it in white, obviously, you know, the same colour as the X-ray. So let's finish off with the blue overlay. Boom. Again, showing all the covering, what they've done, all the doctoring, the hiding of my broken rib, and the damage caused to my shoulder by rhesus. This is malpractice of the highest level. So recently I've found a surgeon who has agreed with what I'm saying here about the damage, and he's offered me surgery, and it's going to take him 5 operations, which he's going to perform in simultaneously, just to try and get my shoulder back together again, to save, you know, to save what's left of my neck. Thanks to Nicholas Rhesus, it looks like this, which is something nobody should have to suffer. There's one more thing I need to explain. The day I was rushed into that hospital, I was actually at a private hospital called the Scone Clinic, seeing the Dr. Natalie, who made all sorts of problems. Anyway, never come to fruition. But while we was talking to him, I asked him if he knew Nikos Rhesus. He said yes. Then I asked him if he knew about all his court cases and all that. He said no. But in the next breath, he started telling us how he's been done for fraud and how he stabs people when he's doing arthroscopies in their knees. He said he literally stabs people. He does an arthroscopy in 2 minutes. And if you don't believe me, have a listen to this. Can I ask you? I will give you one name. Do you know of Nikos Rhesus?
Yes.
Do you know about what he's been in trouble for?
No.
About his court cases?
No.
No?
No.
He's been done for malpractice over 20 times.
And that was because he was doing very quick operations, wasn't he? And that was because he was doing very quick operations, wasn't he?
But hang on a minute, didn't he just say he didn't know about any of his court cases? Now he's telling us it's why he was in them, because he's doing really fast operations. Wait till you hear what he says next. He removed my shoulder during a routine clavicle repair. He removed everything.
Yeah, but he also does arthroscopies of the knees in 2 minutes. Yeah, but he also does arthroscopies of the knees in 2 minutes. Yeah, but he also does arthroscopies of the knees in 2 minutes.
He took all my lung cartilage out, all of it.
This is the point as well. He does arthroscopies in 2 minutes. Then we'll say, how on earth can you do anything in 2 minutes? Because he just used to do stab wound to put it in and pull it out. Because he just used to do stab wound to put it in and pull it out.
He's so intent on covering it up, to put it in a blunt way, they're covering it all up to protect this Nikos Rhesus. He's been done for 20 times. A woman lost a leg because
he's done more than that. He's done more than that.
That's 20 I know of. So you know about his court cases.
Well, he's been struck off, hasn't he? Or he's been suspended by the GSC.
Well, the court case I'm talking about, there was a woman lost a leg. He put a screw in a bloke's ankle when he didn't need it, but Rhesus has lied about the x-rays. 15 other charges were taken into account, and they let him off with a warning.
No, I think
And then he got in trouble again, and then he was struck off.
yeah, he's been suspended.
But I haven't found the details yet of that.
But it's also been done for fraud because
Has he?
because he's said he's done operations billed for them and hasn't been.
Oh,
But it's also been done for fraud because
Has he?
because he's said he's done operations billed for them and hasn't been.
Oh,
But it's also been done for fraud because
Has he?
because he's said he's done operations billed for them and hasn't been.
Oh. That was my first appointment with Dr. Natalie. He made all these promises that he was going to fix my shoulder and he had not going to be any problems. And then we had to go back a couple of weeks later, and suddenly he said there was nothing else he could do for me. And it was just after that I collapsed in the hospital grounds and was rushed to the hospital. I've since found a doctor. It's taken me 20 years to find a doctor to assess me properly and give me an option of having it repaired. 20 years. Everyone else has said they can't do it. There's nothing. Doesn't need doing anything to do anything. Doing, you know, it's just excuse after excuse. And finally, after 20 years, I found this man.
Let's see. Yeah, that's fine. Whatever is easier. So last time we caught up, we made some arrangements and plans.
Yeah.
Have you heard from them yet about the date and stuff yet?
No.
You haven't heard anything yet?
No, we haven't had nothing. No report.
I mean, there's unfortunately a bit of a waiting time with all these things, obviously, as you know, better than I do. But you're basically on the list, as you know, we talked about what we were going to do, that basically we were going to have a look inside, effectively do what needs to be done, which was a combination of obviously injecting the bit at the back, which is very sore around your shoulder blade, dealing with the collarbone being out of place basically and reconstructing the ligaments and trying to bring it forward, putting a camera inside and dealing with the other bits of inflammation within your shoulder joint to try to make the situation better. The big issue obviously with all of that is that it's all about trying to improve the anatomy of your shoulder, hoping that over time will translate into a better, happier shoulder. Yeah. Difficulty is that, needless to say, I cannot give you a guarantee that by doing all of that is going to make it that.
The bigger worry is after the surgery. This is why we feel that we need a report from you or something like that, saying what you just said then, to show the social services to get, because these I've had it before. It's not. We're in Ickenham Uxbridge.
Where is the nearest
Middle Hillingdon, but.
We don't go there.
West London.
No, I know that, but what geographically you're there.
Oh right, yeah.
But how good is your GP?
We've got an online GP.
An online GP, and so far are very good. Better than any other GP I've ever had. Okay. Even though it's just an online one, we can't go and see whatever we want.
So basically, because I guess the question, this is the situation. As far as you're concerned, you need to assume after the surgery, your arm is going to be in a sling for about 6 weeks. Okay. Yeah. During that time, you can still move it. Okay. But you can only move it up to shoulder level. Okay. You can move it up to here, but you're not going to be putting load on it. You're not going to be lifting.
I can't now anyway, so there's nothing new.
Yeah. But my point is, you're not going to do anything physical with it. Yeah. Over the first 6 weeks, you've got to take it pretty slow and pretty steady with that. And then after that, thank you. And then after that, from 6 weeks, they're going to push hard with getting all your mobility back as much as is possible. Realistically, it will be 3 months before you're going to start using it pretty normally for most things. And that's when I would hope that you're thinking, yeah, it feels better, it's getting in the right direction. But because so much of this is about restoring, as we say, normal anatomy, and then subsequently everything will steadily get better. The reality is going to be months before you're going to notice whether it's made a massive difference or not. It's not going to be a case that you have it on day one.
I've been through it before. I've had 3 months on it now. So I kind of got an idea what I'm going to feel like. But that's what concerns me a little bit, because you said I'm only going to be there one day, and that worries me.
You're there as long as you need to be. Okay. Right. The issue is this: is that the surgery, the actual. The level of surgery we're doing is basically one that you're sort of in a sling and you get going pretty much straight away, as I say, up to shoulder level and stuff. But what dictates how long you stay is how much pain you're in and what your state is like. So if you're in a good state, you can go the next day. If you're not in a good state, you might need to stay for an extra night. My point is that we go with the flow. And one of the reasons for trying to organize it where we did, as I say, is because in a way, there's a bit more flexibility about the bed situation there, and we know that once it's booked, we can get it done. Whereas the problem with this bit, the Denmark Hill bit, is that because it's a major trauma centre, things get regularly cancelled because there's always major trauma and stuff coming through the door and gets bumped. So that's what often we do these cases in Orpington Hospital. It's still me doing it, but my point is, it's just that it's a more controlled environment. There's elective orthopedics and everything else with regards to that.
Is it possible for you to run through what the plan? You did mention, I can't remember half of it now. But what you said, there's 5 different procedures.
So there's further. So we look. There's starting from top. You know you've got your neck issue for which there's no simple solution.
No, that's the fact that the shoulder's coming back up.
Exactly. You should offload the pressure. So your neck is effectively a physio job going forward. Okay. Your shoulder has got multiple issues to it. One, that because your collarbone situation and stuff, posturally, your shoulder drooping forward, which is why this bit gets irritated because it's not sitting anatomically where it should be. Inside your shoulder is quite inflamed. Inside your shoulder, you've got a few issues going on. So as part and parcel of that, we're going to go in with a keyhole surgery initially, put a camera in, have a look around, and do whatever needs to be tidied up, fix whatever needs to be fixed.
It's going to be a bit more like trial and error.
No, it's not trial and error. It's pretty scientific because you've had a scan. Don't forget, we know what's going on inside. But my point is that the level of tidying up is what we see basically. So as to what needs to be done is pretty accurate, but how much we need to clean up, it's very much what we see at the time of your surgery, if that makes sense. And we get perfect vision of what we're seeing. You see what I mean? And that's what we did with it.
Can I, something, you know, you said you were going to put in a
artificial ligament.
Artificial ligament.
Yeah.
Is that to replace the supraspinatus tendon? Is it
No,
to do that job?
No, that's the ligament that is damaged, which is the ligament that supports your collarbone down. Okay? So
that means it's all taken out.
Sorry? But it's already removed. It's already damaged anyway.
Yeah.
So my point is that we're just giving you a brand new one with the ligament reconstruction. Okay? So that's what's going to pull your collarbone in a more anatomical position and therefore push your shoulder blade in a better place.
So will you be kind of replacing the AC joint?
So the AC joint is gone, that's been removed, So that bit we cannot create it again. Once it's gone, it's removed. So all we can do, it's in a way, not having an AC is not the problem, is not having an AC and no ligaments to stabilize it is the problem. We are reconstructing the ligament bit because we cannot replace what's already gone. You see what I mean? So your bone is gone. So we can't do anything with that. That's gone, it's finished. We are reconstructing the ligaments, which is going to bring your shoulder to sit in a better place. Once we, so that's in effect doing the keyhole surgery, then this bit, the ligament reconstruction, is a proper cut, okay? So the scar that you have, let me just show me your scar you have in a moment. Yeah, so basically the scar that you have, we will probably just use the same scar that you have there, But if I press there, that's not too bad?
No. It's more when I'm doing certain movements. It's like when I'm in bed at night, I can't lie on my left side because it drops forward.
Let me just have a
so I have to lie sort of half cocked like that, so it falls backwards, and I have to kind of hope I'll stay there all night. But if I don't, if I end up rolling about, I'm just an agony every day.
Hold it in that position.
Push
it inwards towards you as hard as you can. Does that hurt you, or is it not too bad? Okay, if I bring your arm here.
It's more when I'm going like that, or any repetitive movement.
Push up really hard towards the ceiling.
Oh no, that's getting me right there.
That's
there. That's a sore point there.
Yeah. So look, this bit, exactly. That's the bit that we can't do anything surgically with, but we can inject it through.
That's the one.
Right?
Yeah.
This bit is the bit that we've got to decide whether with the ligament bit and stuff that we're going to reconstruct is to deal with this bit to keep it right here, okay? The keyhole surgery is to put it inside and just tidy up what needs to be tidied up, okay? How much we do with all of it depends on partly what we see during the surgery. That's the point I'm trying to make. What we are not going to do is do things that don't need to be done, And what we are going to do is the things that clearly need to be done. Because this will be a one one-stop shop of trying to do whatever needs to be done.
Oh, I got
You see what I'm trying to say? Because what we do not want to do is keep going back and forth with this. Yeah?
Right. Okay. So,
Does that all sort of make sense?
Yeah.
Yeah. But the fundamental thing is that so much of what you need to do is the physio afterwards.
Okay.
It's going to be really slow, it's going to be really tedious,
Well, as soon as
and it's going to take a long time.
Well, the other problem I've got is because of my back, so I can't do sort of many exercises.
So the really physical stuff. I appreciate that, but at the same time...
See, my thing is swimming. I used to swim 3 miles a week.
Yeah, but to be honest, from my perspective, the sooner you can then... Well, it will take a few months, obviously, to be able to resume that, but the sooner you can go back to doing that, the better it is. Do you see what I'm trying to say?
Yeah.
Let me just bring this down.
So I'd be better off going down the pool every day when I'm doing a bit of physio in the
Once you're allowed to get the shoulder moving fully, the answer to the question...
Yeah, we've got a pool that's quite close to us, so that's not going to be too difficult.
I'm going to x-ray your... Because we've got a scan, obviously. I'm going to x-ray your right shoulder and your chest. Yeah?
Okay, oh brilliant, yeah, fantastic.
That's good.
So we will have both shoulders on though, yeah?
But the chest x-ray will have the other side on. You see what I'm trying to say?
Yeah, both.
It won't be... Well, I can get both done, don't worry. I'll do them separately.
How long do you reckon we got to wait then before this... Or don't you know yet?
I want to give you an exact time. I would say it's going to be a few months, yeah? And obviously,
that's
you've got a bit
that's
of time. I mean, I know you waited for years, so
I know,
you can't get
no,
stuff
don't matter. Don't worry about how much I've been waiting. As long as it gets done.
Right, I've done forms. You know where you've got to go for this. If you go across to the other... So where you are, I'll give you directions. Don't worry. Yeah, that's both your x-ray of your chest and your shoulders, yeah?
Yeah, I'm ready.
Alright?
Thanks so much.
Just give me directions.
And we coming back to see you after again, are we? Yeah.
When you're done, come back to sit here.
Okay. Nice and quick.
I've never seen such efficiency.
Well, it doesn't always work, as you know. Whilst it works, let's ride it.
Yes, understand.
Oh, stand Luke.
There we go. So that was your... Oops, let me just go back to the chest x-ray. So they've actually managed to get
one.
So basically what we're talking about, this is your shoulders, okay, in relation to your chest, okay? That is the socket, that is the socket, that is the ball part. This is your collarbone, that is your collarbone. You have a normal collarbone here articulating with the end of your shoulder blade here. You've got quite a lot missing here because that was removed. That's the bit that we can do nothing about, yeah? So the point is that this is the missing bit of bone from your collarbone, this bit here, which this is normal, this is absent, okay? But the actual anatomy of your shoulder, as we said, is more positional, it's posture related, okay? Now, looking at the gaps between your shoulder blade and your collarbone, this is this gap here, this is this gap here, which to be honest, on this view, actually doesn't look too bad, okay? Let me just show you your shoulder specific x-rays. So this is your right shoulder, yeah? So this is your right shoulder now, this is the shoulder specific. This is the ball and socket part. This is your collarbone. This is the missing bone. That's the bit that has been removed, which we can do nothing about. And that's the shoulder blade. And you can see it's sitting a bit higher up in relation to that, okay? When we look at this now on the other side, you can see what normal looks like, okay? So that's your collarbone here, articulates with your shoulder. Yeah. This is the ball and socket. That is your collarbone. And this is the alignment of it. If I go back to the other side again, you can just see it's just a little bit higher up.
So why is there 2 layers though? What's that other layer there? Because you've got a
that's skin and muscle.
I've got a knobbly bit there.
Yeah.
Where it steps up. Yeah.
Yeah. That's where you've had your previous surgery. That's where your scar is.
Yeah, I know. Yeah.
Yeah. That's where your incision is. Right. But it's overall, it's just slightly up. But to be honest, it actually doesn't look terrible on the X-ray. And if we do the surgery and stuff, as I say, we're going to have a look at all of this with a camera and everything else. If actually while you're asleep and I'm prodding you around and everything, this doesn't feel too bad. I don't need to do anything dramatic to your collarbone. Do you see what I'm trying to say? It would then be more about the inside part of the shoulder and fixing whatever needs to be fixed on the inside and tidying it up. Yeah? So we're going to keep it as simple as it needs to be and make it as complicated as it needs to be. But we're not going to do things for the sake of just doing it. Okay? We'll do what is needed to make you better. But we are trying to make you better, hopefully make you cured, but you may well never be cured, but hopefully in a better place than where you are now. Yeah? And then they put all your scans, either your shoulder scan, your neck scan, everything else on it as well. All right?
Yeah, that'd be good.
Is that all right?
Yeah.
Yeah.
Brilliant. Thank you.
You look after yourself. All right?
All right, yes.